Welcome to Montana Matters. We're joined by periodontal specialists of Montana. With us today, we have Dr. Manhart. It's so great to have you back on the show.
Well, thank you for having me again.
Yeah, we love having you on. And today we're talking about implants. So this is something that's happening a lot these days, implants. Tell us more about that.
Well, dental implants, which have become a mainstay of dental treatment in the last 30 years, have really changed how we can approach cases. We can restore function and create aesthetics that we just couldn't do before, and provide patients much more comfort and function in their for eating and their socialization.
Okay, so implants are great for a lot of reasons, but they also come with a certain amount of issues, right?
Just like anything else that we make as human beings, there can be problems. Fortunately, the problems are manageable. Great strides have been made in recovering and treating dental implants that are beginning to have issues, be they soft tissue problems, where patients are just having soreness and inflammation in the soft tissue around their implants. Some implants, unfortunately, can start to lose bone. In the past, before we had new therapy options, a lot of those implants had to be taken out and replaced, which certainly committed people to a lot of extra surgical work. Today, with treatments like local antibiotics, and the big stride for us has been what's called the Nd:YAG laser, which allows us to do a small access surgery around the implants, allowing us to maintain implants that are having problems.
Okay, so that's pretty amazing for folks out there listening. If anyone's had issues with their implants, or you know someone who has this laser technology, really focused on that area, it takes probably a lot less time for recovery.
A lot less time, a lot less discomfort.
Okay.
That's the nice thing. And it allows us to preserve the aesthetics. Whereas conventional surgeries around dental implants, we always had trouble. If they were in the aesthetic zone, we would get tissue changes that patients didn't like. The laser allows us to keep the tissue where it is, and that makes a big difference.
Okay, and you are certainly the specialist in the area. I know you've been doing this for years and years. Dr. Manhart is a great resource if you have any of these issues going on.
Oh, thank you.
Yeah. So what kind of feedback are you hearing from your patients?
Patients really love it. It's a procedure that is not a big impact. They can literally come in, have it done within a half hour to an hour, continue with their day. Very little pain medication needed or anything like this. Occasionally antibiotics will be used depending. But overall, it's a big step forward from where we've been in the past.
Okay, very good news. And who are implants a good fit for?
At this point, almost anybody, as long as they have achieved full growth. We don't like putting them in younger teenagers because facial growth sometimes creates a problem. But once people have reached adult stature, they can be used for single tooth replacement, multiple tooth replacement, and of course, now that's become popular to do whole arch replacement instead of going to a removable denture, which allows gets people away from removable appliances and allows them to function better.
All right, well, Dr. Manhart, we want to thank you so much for all the great information today.
No, thank you.
Yeah, and always great to have you on the show. For more information about periodontal specialists of Montana, we'd invite you to give them a phone call or visit the website.